Hi, I'm Dr. Larry Malerba, and welcome to All Things Homeopathy, your go-to resource for solid, dependable information about homeopathy, a commonly misunderstood but powerful holistic medical therapy. If you're at all familiar with homeopathy, then you've probably heard about the homeopathic aggravation. And aggravation refers to the possibility that symptoms may flare up before they start to improve. It's not unusual for this to occur shortly after taking a homeopathic remedy. An aggravation is more likely to occur when treating chronic illness, and much less common when treating acute illnesses like a fever or a flu. A homeopathic aggravation is comparable to the concept of the healing crisis, a phenomenon that many holistic practitioners have observed in the course of treating their patients. Like the person receiving a massage who suddenly experiences a cathartic release of emotion followed by an improvement in symptoms. Both terms sound rather dramatic and can make some patients feel apprehensive about undergoing treatment. I like to tell my patients that the remedy may stir things up at first before they improve. The truth is, in most cases, a homeopathic aggravation tends to be mild and short-lived. Sometimes an aggravation can be stronger, but the good thing is that it's frequently an indicator that the homeopathic medicine is beginning to do its job. Think of chronic illness as the vital force stuck in a holding pattern, a negative feedback loop in which symptoms persist or repeat themselves over and over. Along comes a homeopathic remedy that's chosen for its ability to break that pattern, thus setting the life force free, enabling it to be more adaptable once again. That initial phase of breaking free from the old dysfunctional pattern is synonymous with the homeopathic aggravation. It may be experienced as a phase of symptomatic chaos, usually lasting a few hours or a day or two, after which the life force settles back down into a new, healthier, more flexible baseline state. Think of an aggravation as the breaking of the status quo of chronic illness. It's the initial phase that leads to the release of the vital force from the grip of the vicious cycle that has been previously stuck in. Illness doesn't usually just vanish into thin air. When true healing begins to take place, the larger problem is often transformed or rechanneled into less threatening symptoms. For example, the baby who's had 5 consecutive ear infections receives a homeopathic medicine and suddenly runs a fever. But this time it doesn't lead to an ear infection. The fever settles down on its own and the child ceases to get ear infections. Or the guy with chronic shoulder pain experiences flu-like symptoms and a worsening of his shoulder pain for a day or two, followed by noticeable improvement in his pain. A woman with depression experiences a strong headache followed by a runny nose for a week. But when all is said and done, her depression is noticeably better. It's not possible to predict with any accuracy what an aggravation will entail. It varies greatly from person to person. Aggravations can vary in timing, intensity, and duration. Sometimes an aggravation takes the form of an intensification of the chief complaint, as if the life force is revisiting its original attempt to heal itself prior to when it got stuck. Sometimes an older symptom flares up, one that occurred before the more recent complaint. I recently treated a woman with chronic debilitating tailbone pain. As soon as she took the remedy, she felt relief from her pain, but she simultaneously developed symptoms that were reminiscent of old sinus infections that she used to get. Although she was sick for a number of days, her sinus symptoms did resolve on their own. The good news is that in the course of events, her tailbone pain had vanished. It's important to understand that an aggravation is nothing like a side effect. A side effect is a necessary evil that one lives with on an ongoing basis while taking a conventional medication. An aggravation is a healing response. It's a manifestation of a vital force that's been stimulated into action. It is not a negative thing. In fact, it's usually a desirable thing. It's the transition phase that precedes recovery from illness. Oddly but not surprisingly, an aggravation is sometimes accompanied by a sense of well-being. In spite of a flare-up of symptoms, the person may report an unusual sense of wellness, or a burst of energy, or a euphoric mood, or something along those lines. If you recall Herring's law from episode 11, it should come as no surprise that an aggravation can take the form of symptoms that are redirected toward the surface or toward the periphery. The person may develop a skin eruption or a discharge like a runny nose or a postnasal drip. Such occurrences represent the vital force's efforts to transmute the illness into a less threatening, more superficial form. To recap, the vital force reacts to circumstance by generating symptoms. If it fails to adequately resolve the problem, those symptoms may settle into a chronic pattern of ongoing symptoms. A homeopathic prescription that matches those symptoms is administered. It stimulates the vital force into action, which then generates an aggravation. If successful, the aggravation leads to improvement in the patient's chronic symptoms and overall well-being. An aggravation may be a sign of a strong and healthy vital force. On the other hand, it makes good sense to try to minimize aggravations in frail individuals with serious illness. There are dosing strategies that can reduce the likelihood of an aggravation, but the usefulness and desirability of an aggravation is a complex topic that's frequently debated within the homeopathic world. It's usually not advisable to take allopathic medicines to mitigate the symptoms of an aggravation. That would be at cross purposes with the aggravation and could short-circuit or thwart the efforts of the life force to heal itself. Unfortunately, some people are conditioned by the quick-fix medical culture that we live in. They have little tolerance for any kind of pain or suffering. It may be necessary to talk such patients through their aggravations, reassuring them that help is at hand in case they need it. Neither is it advisable to take homeopathic remedies for the new symptoms generated by an aggravation. It's usually best to let the aggravation play itself out, which it usually does given no interference from outside forces. Once the vital force has responded to the initial remedy, it's wise to let nature take its course. Time will tell whether the prescription was a successful one or not. Well, I hope I've helped illuminate that mysterious thing that we call the homeopathic aggravation. Please subscribe to the ATH channel at the end of this video. That way you'll be sure not to miss the next episode of All Things Homeopathy.